Patricia Yabra. Okay, and what area are you from? Fort Washington area. All right, so when were you diagnosed with cancer? January 2012. Okay, January 2012. Now, how did it feel when you first got the notice that you had? First of all, what type of cancer did you have? I had HER2 positive, which is a very aggressive form of breast cancer. Okay, so that's a breast cancer. All right, so she's a breast cancer survivor. So how did you feel when you first found out that when the doctor came and told you that you had breast cancer? My whole world went up. I was like, that was devastated because when I got the diagnosis, I was by myself. How you felt when you found out, and how did you expose it to your family? Well, when I did find out that I had breast cancer, I was kind of like was in the car by myself, and I cried all the way home. And I didn't expose it to my family. My daughter did, because I didn't want anybody to know, because I was devastated to know that I was healthy. The second I had a diagnosis of breast cancer. So once my family knew, I just cried for 2 days. I just couldn't let go because of the fact that nobody had cancer. No one in my family ever had cancer. So just to get that diagnosis by itself, it was devastating. So, where did you pull your strength from, or what gave you strength to get back up after those days of crying and keep going? I had to rely on my faith in God, and my strength got even stronger. I had faith before this journey. So when the journey came, I knew I had nobody else to depend on but God. And that's where my strength comes from. Talk a little bit about this day. What was that day felt like when you said, I gotta get up and I gotta fight? What was it like? Well, I just realized that it's nothing I can do. Everything that I rely on is in God. And I just had to say, Lord, this is your time. I can't do anything about it. And I just got up and decided one day, Lord, everything is in your hands and I trust you. And that's what you gotta do. You got to have trust in God. Because without God on this journey, you're not gonna make it. So your name? Denise Payne. All right, welcome, Denise Payne. What brings you out today?
I'm here to support a worthy cause. I work at Doctors Community Hospital, and I work with many of the people that are putting on this event today.
Okay, so tell us what type of cancer did you have to deal with?
Breast cancer.
Okay, and how long have you been in remission?
It's been 11 years.
Woo! Let's clap for that. 11 years. Information that you had breast cancer.
I was at an annual visit with my gynecologist, and she thought she felt something, so she sent me for a mammogram. Unfortunately, they couldn't find anything that first year, but the following year, they were able to isolate still a very early onset of breast cancer. And so, of course, we went about seeking to have appropriate diagnosis and treatment. And luckily I was in my early 40s, and this was not expected, that we were able to, I had a lumpectomy, and I'm still here today doing very well after all these years.
Well, now, was it hereditary? Is breast cancer or cancer run in your family?
No, I had one grandmother, and I had she had it very late in life, and so they did do genetic testing on me because of how early I was diagnosed with it. So I collected all my family history, and they determined that there was no hereditary factor for the rest of my family, which was a relief.
So, what gives you strength? What gave you the strength after you found out to get back up, to push, fight, and not give up, and be determined to become a survivor?
Many things. Obviously my faith was at the forefront. I have a loving husband. I have 2 beautiful boys. Yes. So although I was afraid at the early stages, I had a lot of faith and a lot of support to get through 7 weeks of radiology. radiation, and I was coming out on the other side a very healthy and viable lady.
Wow, I thank you for coming up on the Pink Couch and talking with us on the Leap of Faith Network for our future survivors and those that may be going through it. But before you get up, what would you like to say to someone who may have just found out that they had breast cancer?
There is hope. There's so many people trying to battle against cancer. Technology is improving every day. Early detection is the key, and for anyone who's hesitating with a mammogram, please do it today.
And guess what? That's right, put your hands together for Miss Denise. Want to be getting a 3D mammogram. Many insurance providers cover 3D mammograms. In some cases you may have to pay a little bit extra, but as I tell patients, you pay a little bit extra if it's a nice dress or a nice pair of shoes, so you should pay extra to advocate for yourself and to take care of your own body. We have the full range of treatment modalities here. Surgery, radiation, chemotherapy, hormonal therapy. We have it all here in Prince George's County, here at one location. We do it differently than everybody else. We navigate patients. We have great navigators. We have wonderful doctors who really take the time to listen and really to treat each patient as an individual. So we encourage you all to come down here.